tear, it falls and hits the ground. A tree, it falls without a sound. A bird, it calls and sends you home. A man, he sits in the cold all alone.
Hi, Jill. Welcome to the Joy of Sunflowers. Thank you so much for joining me. Please introduce yourself a little bit more.
Thanks, Ella. So happy to be here. On a difficult topic, though. I'm Jill. I'm from the United States in Massachusetts. I have been going through infertility treatments off and on for what feels like the better part of my 30s. And it's been a rough journey. And along the way, I did have one really, really hard loss and lost my daughter in 2021. And back in the fertility journey again, trying to see if we can bring home that living child.
Yeah, no, it's a tough space to be in. Filled with amazing people, but it's tough to be in this space. So let's start at the very beginning. Did you always know you wanted to be a mom, or was it something that you sort of grew towards?
I think I grew towards it. I remember, when I was real young, I don't really remember that desire urge to necessarily be a mom, but I remember as, my husband and I got married and then some of our friends started getting pregnant and having kids. I remember like thinking to him and saying to him, like, I want that for us too. Like, I want to do that. I want that to be part of our journey. And I want to do that together. And so I remember that, happening, I'd say, like 10 years ago, certainly. And I'm sure I had glimpses before that of wanting to be a mom, but it was never like, oh, I have to be right now. But it was always in the back of my mind. But then, I don't think my husband and I ever thought or dreamed that it would take as long as it has. So I think, we were like, oh, well, we'll wait until this specific point where we'll start trying and it'll be fine. It'll just happen. And, we'll try for a month or two and we'll get pregnant and it'll be fine.
Yeah, I mean, that's what we're taught, right? We're taught, you do the deed.
Yes.
You get the baby at the end. And I think, it's very misleading, isn't it? Because, we can just wait. It's fine. Like, nothing's going to impact my ability to make this happen. And yeah, it does seem like age is a factor. Not that I would say that. Like, we don't want to think of that. Like, well, it's kind of unfair. Like, women, even more so than men. Like, men can keep producing and producing. Like, not all men. So for those who can't, I'm very sorry. I know that would suck even more. But yeah, like, we only have a certain amount of eggs, and then we reach an age, and then apparently the women in my family, like 43, 42, that's when they start going through like premenopause. And I'm like,
oh, wow.
I'm turning 30 this year, so I'm kind of like,
Yeah, no, when we started trying and it was a year, we went through that year mark that they always tell you, oh, try for a year when you're, under 35, which I think is a horrible suggestion for what it's worth. And so we were like, all right, let's start to get testing. And then we finally got testing and they were like, you have premature diminished ovarian reserve. And I was like, that would have been great to know. Why aren't these things that we test for in our 20s? Like, why do we have to wait until we're trying to have kids? Like, let's figure this out sooner.
Yeah, and I mean, sometimes as well, like, there's warning signs. Like, I've spoken to some women where they had warning signs like when they were 16 and they were just put on the pill. Like, that's what we're all like, a lot of us have that experience where, you go into the doctors, you go, I don't have regular periods, I'm having a hard time, it's really painful. They're like, okay, here's the pill, it'll make it better. And we just kind of accept it. I mean, I did, like,
same.
They said, I was in agony, and I thought it was normal.
Yeah, same with me. I had crippling cramps, and my mom was just like, oh, just take some ibuprofen, you'll be fine. And then I finally went to the doctor, and the same thing. They were like, yeah, just go on the pill, it'll be fine. Okay, sure.
Yeah, and everyone just normalizes it. But then you look at these like hormone therapy like gurus and like naturopaths, and then they're all saying, no, you can have pain-free like periods.
What's that?
Stuff. And I'm like, I only learned it through this,
Yeah.
Oh, it's insane. So you guys sort of tried for a year, and that's when you sort of realized, okay, we're going to have trouble doing this. And then you got that diagnosis. So where did you go from there?
Yeah. So I think, and it was funny, we didn't even get that diagnosis right away. I went to my regular OB doctor and obstetrician, and she really didn't do any testing. And she was just like, oh, we'll just do an IUI. And like really without much testing. And I was like, again, I didn't really know yet. I don't know as much as I know now. I feel like I could be an infertility doctor. And so we did 2 IUIs with her. And then she said, yeah, I think you need to go see a reproductive endocrinologist. And I was like, okay. And so that's where we just started doing the testing, and where, I found out about my diminished ovarian reserve. My husband had some issues as well with his semen. And so it was, at first it was just like, wait, what is happening? And then honestly, I just felt like, okay, well, let's just go. Like, just go. This is what we have to do. So let's just start. And so I feel like we pretty quickly jumped into an egg retrieval cycle. Like, I feel like we met with the doctor, did our testing, and probably within a couple of months, it was like, all right, let's do this. And I think it was just that like thought of like, okay, well, I want to bring home a child, and this is what we have to do. This is our only option. So let's go.
Yeah. Was it very much, it sounds very much like it was like sort of checklisty, like,
yes.
So we can't do this. Okay. So we need to do this, 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 and this. And then, we'll have a chance.
Yes. That's exactly right. It was very checklisty. It was, I would say that's probably carries from our first doctor that we had. That was just kind of like how she was. It was just, here's your information and move forward. And there wasn't much empathy or compassion in those appointments. It was just, here's your information, go. And so it just became, yep, check the box. Let's just do this.
Yeah, sometimes I feel like that's actually better than some of the other things that I've heard. Like for myself, the doctor actually talked into like the pregnancy loss and stuff like that. And it was like, that's not empathy. That's like just making it worse. Please stop. So I feel like sometimes that can, like the cut and dry, like this is the medical, that can sometimes be better than, and I mean, obviously it kind of helped in terms of mindset and that mentality. And I mean, when you're going through this journey, you kind of lose that control. So now you've kind of gained that control in a sense. Did you feel that way? I don't know.
Yes and no. I think what I struggled with, especially after our first cycle wasn't successful, I think what I struggled with was, for so much of my life, I had this concept in my mind of I can work hard and achieve things, right? I can study hard and go to a good school. I can study hard and get a degree that I want and apply myself and get a good job. But suddenly when it came to this, I was like, well, I can do all the things. I can take all this medicine. I can do everything the doctors are telling me, and I can get great results. And then that wasn't the case. So like, it almost felt like for a piece of it, for me, the control was taken away, because I could do everything that they're telling me, but it doesn't mean anything. And I'll also say, fast forward, 8 years later or 7 years later from when I first started, add in all of the other things that we all try, right? Like cutting out this food, cutting out that food, cutting out all of this toxic or that toxic, and changing your shampoo and your makeup. And so all of the things that I possibly had kind of within my control and I would change still hasn't done anything yet. So like, there's that piece too, that almost feels like a little bit out of my control.
Yeah, a lot of people have mentioned that, like, it's not, because we're in this society that's like, oh, if you work hard, you'll get there, and it really has been something that's been drilled into us, like at school, and all you have to do is work hard. And our parents said that to us too, work hard, go to uni, get a good job. And yeah, when it comes to fertility, I mean, it really doesn't like mean anything. Like you can work your ass off trying to make this happen, and all of you women do, and sometimes it doesn't. And I think having that understanding within our society would be really helpful. Not that we're getting there, I think.
Slowly.
Yeah, I think conversations like this can help. So thank you for sharing your story, because I know, you know, going through that for so long can be quite full on. How have you been dealing and coping with how long your journey has been, and just continuing to move through it?
Yeah, I think, you know, for me, is one of the huge thing that's helpful for me is my husband and I see a therapist, and we meet with her. Right now it's every other week, and that is helpful to talk through the ups and the downs and the emotions. And I mean, you bring up a whole bunch of other things along the process when you're, you know, when you're working through that, but I think having that person to talk to is really helpful. And then just trying to build that support network of, you know, close friends and family that you know you can trust and rely on. And sometimes that's a small group that you feel like you can really rely on, because it's hard when people just don't understand it. If they haven't walked any portion of this path, they can try their best to be supportive, but sometimes it's hard because they don't understand it because they haven't been there yet. And so if you don't have to walk through this very tiring process of IVF, it's really hard to truly be able to put yourself in those shoes and support somebody going through it, because I don't think you can really understand what it's like until you've been there. But I do appreciate the people who have tried to support, you know, even though they haven't walked that path yet.
Yeah, totally. And I mean, I've been through loss, but I look at women who go through IVF and I can't even fathom like what that's like, that experience. You know, I mean, I see you guys just sticking that needle in and I'm like, wow, you're like, what a warrior. I needles. Like, I'd look at that needle and be like, nope, I'm good.
Yeah, I think my first set of shots, my husband gave me the injections. And then for another round, I had to travel during one of the cycles. And I was like, well, I guess I have to give myself the shots because he's not with me. And so you just say, well, this is the only choice. This is how it has to be. So you just grin and bear it and just do it. And then it just becomes almost second nature. Like you're just like, yeah, okay, it's just another shot. And you just go through it. I mean, candidly, for me, my loss was far worse than the rounds of IVF, but the IVF adds up, right? When you start doing it time after time after time and feeling like failure after failure after failure, it definitely starts to wear heavy.
Yeah, I mean, I think that's the thing about going through IVF and going through those treatments, because it's not, see, with a pregnancy, you're like, okay, I'm going through this pregnancy. And then if you go through a loss, then you're like, you know, you have that moment of kind of like that understanding of what's happening and what you're going through. There's a light at the end of the tunnel, because obviously it's got to end at some point. Whereas with fertility treatment, you're on that wheel and you're just kind of, you know, so I feel like it's a limbo.
Yeah.
You know?
It is. And you never know where you're going to end up, right? Like there are plenty of people who get super lucky, lucky loosely speaking, and will do one round of IVF with an egg retrieval, and their first transfer, they'll get pregnant. And that's wonderful. And I'm so happy for that. But there are so many other people who that's just not the case. And so to your point, yeah, you're just kind of on this wheel of going and going, and you never know where your stop is going to be and what that stop is going to look like.
Yeah. Yeah. And I mean, everyone has their limit, you know, there is a door that I've kind of understood from talking to so many women, you know, and that door is open right now, but at some point you'll know when to close it, you know.
Yeah.
Whether you have a living child with you or not, that door is there, and at some point it will get closed. So I guess that is kind of the light, you know, at the end of the tunnel, but you don't know where that is. Like, every woman I've talked to, they're like, you know, they've had moments where they're like, no, I can't do this anymore. But inside they knew that they were going to continue. So it's, that apparently when you know, apparently like it's very set, but I don't know.
I think that's what I've seen from other people in the community as well, is like, you just get to that point where you know. And I mean, I think for us, like we have several embryos left right now. But I think if heaven forbid none of these worked, I think that would be our door. Like, it's just been such a long, you get tired of constantly putting your life on hold just for fertility treatments, not being able to plan a vacation that you really want to take because, oh, well, you can't go to the Caribbean because you want to try to get pregnant, or you want to just plan a vacation a month and a half out, but what if we get approved for another cycle and then we get to start a cycle? And so at some point you just start to feel like, I want to bring home a living child, but I also want to live my life too.
Yeah, I think when you have a goal in mind as well, and I mean, I'm not saying that a baby's a goal, but it kind of is, like having the goal, right?
Of course.
So when you have that kind of goal, you put your life on hold, you put things on hold because you're like, I want to make this happen, and sometimes that hold is for years, like. So how did your sort of journey through these retrievals kind of happen? Because obviously you said you started, you knew straight away, like, okay, we're going to do retrievals. So how did that sort of go from there?
Yeah, so we started, when we started, we did our first egg retrieval. We had one embryo and we did a fresh transfer, and that was not successful. I don't produce a lot of eggs, so I've always struggled with that, again, with the diminished ovarian reserve. I'm just a poor responder. Our second cycle, we actually got no embryo, so that was really defeating. We then started with another doctor, a different doctor, same clinic, but new doctor, and did a couple of cycles. Did a few transfers, was able to get one frozen embryo. Again, still no pregnancies. So then we switched clinics, and did an egg retrieval where I had, for me, pretty good results. And so got a couple embryos that we could actually test, and all three of them wound up being normal, which was great. The first transfer didn't work, and then of course the pandemic hit, so we got put on this indefinite hold until we could transfer again. And then in 2020, the later that year, we transferred should have been or was our daughter in September, and over the moon, ecstatic, so happy to finally be pregnant. And then, unfortunately, in February of 21, we lost our daughter. And so that was, really, really hard, especially, she was a genetically tested embryo. Everything was supposed to be fine and great. And we learned at the anatomy scan that everything wasn't great. Everything was very far from great. And so that was just really, really hard. And going through that loss was really difficult. I also just went through a lot physically after we lost our daughter, Hadley. I had to have a DNC, two DNCs technically, the second of which I hemorrhaged, and that, and then like a month and a half later, went in for a hysteroscopy and for still retained placenta, and the doctor punctured my uterus, and then a month and a half after that went back to a different doctor. And he was like, yeah, you still have retained placenta. And I was like, you need to put me under anesthesia to take care of this, please. And so it was just a very long journey of like even just trying to be at a point where I could even start trying again. And then, we've just been back in the IVF cycle, the last, I guess, year and a half or so since we were able to actually start trying again. So it's been a lot. And of course, emotionally, it's hard. And then you start living in that world of, before we had Hadley, it was always okay, by, my 33rd birthday, I'll be pregnant. By my 31st birthday, I'll be pregnant. By Christmas, we'll be pregnant. And none of that would happen. And now we're in this world of, okay, by Hadley's first birthday, we'll be pregnant. And now it was just past her second birthday. And, it's really hard to just, like you said, be on that wheel that we talked about, that's just going round and round, and you don't know where it stops, and you don't know where you get off, and you don't know what roller coaster this wheel is on and where it goes.
Yeah. But I mean, it sounds like you are holding on to hope, and that's so important and so good. Like the whole, by this point. And I think, having that just kind of gives you something to keep yourself kind of okay,
Yeah.
Because it is a hard journey if you don't have something that you're kind of that smaller goal of, okay, I want to be pregnant by then. We'll be then. So even if you don't reach it, you can then set another one, you know, and like,
right.
So it's obviously you hope and, you know, but I think that's a really great way of kind of imagining it and having it. So how did your loss go? Like, how far along were you when Hadley passed away?
Yeah, so I was at my 19-week anatomy scan. We found out that she likely had some brain malformations. After several weeks of testing and meeting with specialists at several different hospitals throughout on the East Coast here in the United States, she was diagnosed with severe ventriculomegaly, hydrocephaly, and a rare brain formation called rhomboencephalosynapsis. And so they told us, you know, essentially she would, if she even made it to full term, they seemed very surprised that she was even still alive at that point. They told us that she wouldn't have a good quality of life. She would live a very shortened quality of life, or sorry, just a very shortened lifespan. And she would be in constant pain and suffering and would just essentially have to live in the hospital and just need surgery after surgery and never get better. So I'll never forget the words that one doctor told us, but he said, you have two choices. You can either bring her into this world and all three of you will be in pain and suffering, or you can take on that pain and your daughter will only ever know your love. And so that was the decision we made. And so I induced labor when I was just a couple days shy of 6 months pregnant. And we brought Hadley into this world just a couple days before I was 6 months pregnant, just at the time frame in Massachusetts where I was allowed to do that. And we stayed in the hospital for 2 days and spent 2 days with Hadley and sang to her and read to her and told her stories and just soaked up every inch of her while we could. She did pass away shortly after she was born, you know, with us on my chest, but you know, those are moments we'll forever cherish, you know, being able to spend with her. So it was really hard. It was, you know, as all of us know, that moment you get that positive pregnancy test, you have all those hopes and dreams and things that you're going to do with your child, you know, when they're born, but also when they're, you know, 5, 10, 15, or even 20, and the things you think and dream about. And then it all just gets ripped right from you. And it's devastating. And you just have to relive it, at least a piece of it almost every day, you know, without them here.
Yeah, exactly. And I think that's something that's often overlooked, you know, the dream aspect, the hopes, the, you know, imaginings of child, because it was a child in our mind, because we like we'd already envisioned it all, like we'd envisioned their wedding sometimes.
Absolutely. 100%. And I think that's why I always try to remind people, like, there's no reason to ever compare losses. Like, everybody's loss is different. And from that moment, we find out that we're pregnant. We're all over the moon and ecstatic and happy and hopeful. And whether you lose, you know, your baby at 8 weeks or 20 weeks or 30 weeks, it's devastating for you. And it's okay to feel completely devastated. Like, don't diminish how you're feeling because you feel like, oh, my loss wasn't as far along as somebody else's. Like, it's still okay to feel completely devastated.
Exactly. And I'm so with you on that. Like, there have been so many terminologies that I've learned that they just really upset me. I'm like, like chemical pregnancy. I'm like, well, you got a pregnancy test. It was positive. Why are we calling it a chemical pregnancy? Like, it's a pregnancy loss. It's a miscarriage. I don't understand how we can come up with these like names for things when, you know, it's the same thing. It's
yes, 100%. It's a loss. I agree with you. The terminology in women's healthcare, like, at my age right now, when I get pregnant, I will be a geriatric pregnant woman. Like, that's insane to me.
Geriatric,
that is the term for somebody, at least in the United States, pregnant, age 35 or older. Geriatric.
I haven't even looked into that. I should probably do that. I'm like, oh my gosh.
Geriatric, that makes you feel great.
It's like when you go to uni and you find out you're a mature age student at the age of like 20 something, and you're like, what?
Oh, really?
What are you talking about, mature aged?
Yeah, I don't feel very mature yet.
Yeah. Especially when you're under 25.
Yeah.
But oh my gosh, like it's atrocious, isn't it? Like,
yeah.
I don't get it. I think, and like there's some other terms as well. Like there's something to do with like the cervix, like
Incompetent cervix.
Yeah. What?
Yeah.
That sounds so terrible. Like,
yeah. And it sounds like the woman could have done something about it.
it's like that's just yes. You have an incompetent cervix.
Right.
That's just terrible.
And it really is. Yeah, the terminology in women's healthcare, it really boggles my mind a lot.
Yeah, and like just how they can just say it. Like just no big deal.
Yeah, when I was in the hospital for my second D&E and I had hemorrhage, so I had a balloon and packing, and I had a male resident come in to remove the packing, which is essentially gauze. And he's like, "Oh, don't worry, this won't hurt." I don't think you have the same body parts that I do, sir. It hurt. I can assure you that it hurt. I was just like, how dare you tell me whether or not this is going to hurt? You are not in a position to tell me that this is or is not going to hurt.
Oh, when people say that stuff, it's just like you have to laugh, otherwise you will just cry. Yeah. I don't. I've never understood that kind of thing, like where they're like, oh yeah, it's not going to hurt. It's like, you don't know my body. Like,
correct.
What hurts you might not hurt me, but what hurts me might not hurt you. So
yeah, absolutely. Completely agree with you.
Yeah, maybe he had a patient that felt nothing.
Yeah. But doesn't mean the next patient will feel the same way.
Yeah. Well, you certainly didn't. So how was that process? You said it was, I mean, it sounds pretty like traumatic, like having to go times. So you had the baby in the NICU, guessing for a few days. Was it in the NICU or was she just
No, she was born and then she just passed away on my chest probably 10 minutes after she was born.
And then you got 2 days with her?
Yeah, they let us stay in the hospital for 2 days. They had what's called a cuddle. It's called a cuddle cot, which is not a thing that you would want for any other baby, but it circulates cold water through a pad, so that it keeps the baby's body cold, so that you could spend time with them.
Oh, I think that's so lovely that they can do that, like that, for that service, like, because I've heard so many women say that they wish they'd had longer.
Yeah.
To the point where I said to my husband, like, if we lose a baby, that late on, like, I'm bringing it home, putting it in the freezer. And he was like, what? And I'm like, well, because then I can take as long as I need. And he's just like, I don't think that's healthy. Like,
yeah, but they do have things like the cuddle cot, at least at the hospital I was at, and they are more and more common. So definitely for women who are either gonna go through a loss, have gone through a loss, I would definitely encourage you to ask for a cuddle cot to be able to spend time with them. Because I agree, like I've heard people who are like, I left 2 hours after I delivered my baby, and I'm like, you did what? Like I couldn't imagine having walked away that quickly. I was there for 2 days and it didn't feel like long enough.
Yeah, exactly.
It was so hard to walk away.
Yeah. Some women like can't face the baby at all. Like they just don't, they just can't face seeing anything. And sometimes the partners will, like the husband will go and have a look and like hold the baby and do all the things. And they'll ask their wife, are you sure? And she's just like, I can't, like, I just can't deal with it. Sometimes there's regret, but then sometimes, there's that understanding of that was how you were in the moment, and you need to kind of honor what you were going through, how you felt.
Absolutely.
But that's so amazing that you were able to do that, that you could spend that time and do so with your husband. In that moment. How did you guys go with that, like together, spending that time and having that moment?
Yeah, I think, I mean, I knew for me going, when we found out that this was a path we would have to take, I knew for me, the only option for me was to induce and to deliver Hadley. And I know it's a personal decision and everybody has to make their own decision. Surgical termination is also an option. That just wasn't, I knew that wasn't right for me. And so I remember, you know, the week leading up to delivery, and I said to my husband, I was like, we're going to take pictures. And he's like, wait, no. And I was like, yeah, we're going to take pictures of her. And he was like, no, we're not. And I was like, you don't ever have to look at them. That's fine. But I know that I want them. And there's a service, at least in the US, called Now I Lay Me Down to Sleep. And they offer photographers that will come in. And so they came and took pictures of us and Hadley. And I mean, there are favorite pictures, and my husband is very grateful that I said, yes, we're going to do that. And I think leading into the delivery, I think what was hard for me was, and both of us, was one, not knowing what to expect, like, because we were so early, if you will, in our pregnancy, not that early, but midway through our pregnancy, neither of us had taken any classes on what to expect. This was our first child. And so we kind of felt very blind going in and not knowing what to expect. And also in terms of Hadley, like, I wanted to like get things for her to wear, but I was also like, she's going to be too small even as a preemie. Like, I don't even know what I could possibly get for her. So all I could think of was to just order a couple of swaddles offline, you know, that I thought were really pretty, and have those delivered. Luckily the hospital did have like hand knit clothes that people donate. So they did have clothes for her, which was really sweet, and little hats. And my husband spent a lot of time working on a birthing plan. Like, he just did a whole bunch of research and tried to find as much as he could to get us as much information and to try to get us prepared. And so, you know, we knew we wanted to be able to bathe her. We wanted to make sure we got her footprints and handprints, and just to, you know, spend that time with her. But I mean, going into the hospital, other than that, it was very, like, I just didn't know what to expect. And that was really hard. And it was, you know, really obviously very painful being induced and just not knowing what to expect, not knowing when I'm supposed to ask for pain medicine, not feeling like I should, because I just felt like, oh, I'm too early, I shouldn't need anything. And the nurse was kind of like, no, like, it's okay, you can ask for medicine, like, we can help you with the pain. And then we just brought, you know, my husband had bought a book with like a matching stuffed animal. And so before we even knew that Hadley was sick. And so we brought that with us, and just a couple other books, and just to have, you know, books to be able to read to her and spend that time together. So it was really just what felt right for us. And it's such a personal decision. It's such a personal choice. And, you know, I hope as we get further out from our loss that we can maybe put together more resources for other people who are going into that situation, so that they may have some information available, because it was, you know, scrounging the internet, not even knowing what to look for. So just trying to do what felt right for us to cherish those few moments we would have.
Yeah. It's shocking how there really is such little information and little resources in terms of, like, when you are about to go through it, you know, it's because I mean, all of us do the same thing when we know, you know, we're going to go through something, like whether we're going to, you know, deliver a stillborn or an early baby, or go for a miscarriage.
Yeah.
You know, we try and find as much as we can, and so lacking. Lacking. There are some great places that you can go, like the miscarriage hope desk.
Okay.
And I think there's like stillbirth day.
Okay.
It's quite good because it kind of gives you what the babies look like and stuff. But yeah, there is still a lack there, and obviously you didn't even know about them, so therefore, definitely not loud enough. We've got to be loud.
No. Yeah. Because as much as people are starting to talk more and more about, you know, different types of losses, and it's still not talked about enough. Like, I feel like we're just on the cusp of people starting to feel comfortable talking about loss. And there's just so much room for growth still to just make it a normal part of conversation. With the amount of pregnancies that end in loss, it should really be a much more common part of a conversation, that is just talked about with more resources available.
Exactly. And I mean, even down to like just the understanding that even if you are miscarrying or you're going to be delivering a baby, stillborn, whatever, it's that understanding that it's a delivery, like you still have to labor through it, because that is missed. Like when I had my miscarriage, I was like, oh my gosh, this is labor. Like I'm going through labor right now. And I was so shocked because I didn't expect that at all. Like everything I'd read about my type of miscarriage, because I had a blighted ovum, everything I'd read was just that, it sort of, I mean, I was told it was going to come out in clumps, but I had a whole egg, like literally the sac came out. And so I was like, what? Like no one told me that. And like even the internet let me down.
When after I delivered Hadley and I came home, and so we were planning her memorial service, but again, like when I left off the hospital, I said, are there discharge papers, like things I need to know? And they're like, here's some generic information, essentially. And so I came home, and the next day I went to the funeral home. I went with my husband to the hardware store because he wanted to do some things and build like a memorial box. The next day I went to the craft store, then I went to the grocery store, and I was feeling horrible and so much pain. And my husband's like, yeah, you need to go home and rest. And I was like, but they didn't tell me that. And he's like, please go home and lay on the couch. And I was just like, but I didn't know. He's like, yeah, just go lay down, please. And so you're right. Like, there's just not enough information. Like it's just, just go through this. You're fine.
Yeah. So they didn't, again, you didn't hear about like postpartum and postpartum.
No.
Yeah.
No, not at all.
Yeah.
Not at all.
Well, yeah, we actually have some registered nurses who talk about postpartum care for after on this event. And it was a real eye opener for me, because I realized that women could produce milk like at the 20th week mark. Did you have anything, like any sort of, I want to say side effects? I don't know. Like, did you have any things that like happened postpartum after having delivered Hadley?
No, but I think, I don't know this for sure. I don't know the actual science, but my assumption is because I had retained placenta for several months after that, I never had milk come in. And everybody kept telling me, I had 2 nurses that told me, yes, you'll probably get milk come in, even when I went back in for my second D&E for our D&C for retained placenta. And the nurse there was like, yeah, I think you're going to get your milk come in. And I never did. So I assume it's just because I had retained placenta. So my body was just very confused. Like, what is happening? What's going on? So that just never happened. For me, the only side effect I had was I wound up with Asherman's, which is scar tissue inside the uterine cavity. And again, this is one of those things I wish somebody would have told me, but apparently like causes of Asherman are having to deliver early and then having more than one D&C. I did both of those, met both of those requirements, but nobody even mentioned it to me. And I remember messaging one of the physician assistants at my office because I was like, yeah, something's not right. And I was like, I think I might have Asherman's. And she was like, let me do some research on that. And I'm like, why am I telling you about this? I feel like you should know about this. This is your field.
Especially if they're going to be, recommending, doing certain procedures,
right.
If they're going to recommend you have the baby early, they need to know what
all of the risks.
Yeah. That's so shocking. I mean, I think the way your doctor phrased it as well was quite shocking in terms of like, you have 2 choices. Like, I felt like that was very insensitive and very bias. I know a lot of women have done it in many different ways, like, you know, sort of maybe waited longer and then had the inducement, but still had an inducement, or maybe had a termination. But yeah, I feel like that was quite a shocking thing to have said to you both. But yeah, they need to do research. They can't just tell you to do things and not. I can't believe they didn't say that could lead to further like issues later.
Yeah, and I mean, I know, again, just because I'm so involved in like the TFMR, termination for medical reason community, like how many women I've heard that either got pushed in one direction or another, like either got pushed to go and have a surgical termination, or others who got pushed to have, you know, to induce delivery, and like they weren't even given an option. Like, I'm grateful that I knew I had an option and I knew what I wanted, but there are women who like literally didn't even know that they had an option. Like, they just had doctors who were like, you need to have a surgical procedure, and they were like, okay, and then they learned after that they could have done something different, and like they have regret because they're like, well, I wish I had known that before because I may have done something differently. And so like even at that point, like to not have all of the facts and all of your options laid out in front of you, it just seems like it's just horrible. Like I couldn't imagine being in that situation to feel like I didn't get all the information that I needed.
It's like lunacy, isn't it? It's like,
it is.
It's so topsy-turvy, backwards. Like, it's your care, and they're supposed to be the expert, and they're supposed to tell you these details that are important to your health, including like postpartum. And by the way, you might want to rest after.
Exactly.
Well, you know now.
I do know now. Yes. I know now that hopefully when we bring home a living child, I will very much be relying on help from my husband and others. Especially in those first couple of weeks, so that I can rest and heal and be the best me I can be.
Yes. And I think as well, like, it's not just the physical, there's also mental, like, health as well, like just resting your body and mind, because it's traumatic going through labor, regardless of you know, having a living child or not. It's a process, and it's a lot for your body to go through. It's a lot for you to go through mentally, and it's, you know, the pain and everything. You know, I am fortunate enough to have living children, and I had them before my losses, and so I knew when I was in labor with the losses. But yeah, I can tell you, it's, you know, the experience, you know, for both of them, traumatic, painful. It's, you know, it is an ordeal. It's something you have to recover from, and it just boggles the mind that they don't say that to you.
Not enough education.
No, not at all. So from there, I mean, what was it like leaving the hospital? Because I know you had the 2 days, but then you had to leave. So
that was probably one of the harder parts. For us, we knew it was getting time to leave, because, you know, you could start to see a little bit of discoloration like in Hadley's legs, but we still didn't know like when and how to leave. We knew it was our time to leave when the first nurse that was there when we got to the hospital, that like got us settled in, that helped us that first day when we got to the hospital, came in to check on us, and she was like, I'm gonna be with you guys today. And that was when we knew we could leave, because I was like, how do we leave her behind? And she was one of only a couple of people that I had encountered during our stay there that I was like, I trust her. And so for us, it was a personal choice. I asked her to take Hadley out of the room first, because I couldn't imagine leaving her in an empty room with nobody there. I had to at least feel like she was moved somewhere where she was going to be with somebody somewhere. And maybe she wasn't, but in my mind, she was not going to be left in a room alone as I walked out. It was devastating. It was heartbreaking. It was, like I said, probably the hardest part, was leaving without her. And I remember being in the wheelchair, being wheeled to the elevator, And I had a box on the infamous box that so many of us experience, that we hear people talk about. I leave with a box instead of a baby. And my husband just had bags, and we're still on the labor and delivery floor, not at the elevators yet. And somebody just looks at us and says, "Oh, congratulations." And it was somebody that worked there. And I was just like, I think you're really missing something here. Because if you'll notice, there's no baby with either of us. So it just felt like we just really got kicked when we were down. Like, and that's where I was like, again, I just wish there was some more education, communication to some of the staff, not every delivery is a happy delivery. Sometimes they're filled with tears and sadness. And so it was hard. And when I left the room, that was my first time seeing on the outside of our door, they do it's a little card that has a leaf with a raindrop in it to signify that there was a baby loss in that room. And so that was my first time seeing that for our room, but then seeing it on more than one door. And that was also just that realization of yeah, this happens a lot. This is heartbreaking, and it happens a lot. That just in our small, medium-sized hospital, there was more than one set of parents there that had lost a baby.
Yeah. That's really good that they do that, because that is something that, I think that kind of protects the families for just the moment that you're in that room. I'm not saying it protected you after, because when you got to that there was no protection there.
Exactly.
You need to have badges.
Yeah. Seriously.
It's terrible, doesn't it? But a badge that represents that this has happened. Please don't say anything to me.
Yes. So, yeah. Please just don't say anything.
Yeah. Yeah. Or just, I'm sorry. That's it.
Yes. That's it.
Yes. But it's because the amount of stories, I'm sure you've heard them, terrible stories, terrible things that people say because they don't know,
Yeah.
So having that on the door, I think, is such a great practice that they have there. But seeing more of them. But I mean, I know that it's horrible, and obviously we don't wish it on anyone, but there is comfort in knowing that we're not on our own, that we didn't experience our own. So you were going through that while another family was going through it with you at the same time. And you know that for a fact because there were the teardrops on the other doors.
Yes. Yep.
It's horrible, but there's a certain amount of comfort that kind of comes with not being alone, I think.
Yeah. Yes.
So how did you guys go back into normal life? Now I know that was normal after going through, the experiences, let's face it, and obviously things started to sort of go wrong, you started feeling pains and everything. So what was the transition from kind of going home, living however we live, I don't know how we all live, to be honest, dealing with this thing, and then realizing, okay, there's another issue here?
So I think it was, I didn't think I realized anything at first, because again, I was moving about too much when I should have just been resting. And I was like, oh, I'm bleeding a lot, but again, I'm not resting, so maybe I'll rest. But I started messaging my care team about a week after I delivered Hadley, and I was like, I'm having weird pains in my sides. Is this normal? And they were just like, everybody heals differently. You're fine, was essentially the message I got back. And so then a few days later, I messaged again, and I was like, I'm messaging because my daughter's service is on Friday. So I'm not coming into the hospital after today, regardless, because I'm not missing her services. So if something's wrong, or you think something might be wrong, can I just come in today? And they again were like, no, everybody heals differently. You're probably fine. And my appetite hadn't been great. I hadn't been eating a lot. And so we had our service on a Friday, and I didn't eat much because I just felt like I couldn't. And then it was the next day that so it was 2 weeks in a day. We had food delivered, and I took 2 bites of food, and I was like, I can't eat this. It hurts. My husband's like, what do you mean it hurts? And I'm like my whole side of my abdominal like wall, just like I'm in excruciating pain. I can't eat. He's like, I think we need to go to the hospital. And I was very hesitant because my brother had flown home for the services. And I was supposed to spend all day the next day with him. And so I was like, no, like we can't go right now. Like we're gonna wait until tomorrow night after I spend the day with my brother. And he's like, okay, if you don't feel better in the morning, we're at least gonna go to a clinic. And so I woke up in the morning and he's like, yeah, let's go to a clinic. And the clinic was like, yeah, I think maybe you have appendicitis. You should probably go to the hospital. And then we went to the hospital and sat, in the emergency room most of the day. And the obstetric care team finally came in and they were like, yeah, we're just waiting on the results. We don't think it's anything, but if it is, we'll come back in. And then they came back in and I was like, yeah, retained placenta. And they were like, yeah, you have a retained placenta. And it was a Sunday night and they made my husband leave the hospital because it was a Sunday night. And they were like, oh, it's an easy procedure. It'll, you'll hear from us. Normally she would just go home right after this, but because it's a Sunday night, we'll just keep her until the morning. So, we'll call you when she's out of surgery. And then nobody was calling him. So he finally had to call the hospital, which turns out is very difficult to do on a Sunday night. And he finally just got kept getting transferred and finally got to literally the recovery room nurse. And she was like, oh, she's here. And he was like, nobody's called. So that was, that was difficult. The next morning, they brought me back to heal in labor and delivery because they insisted that there was no other floor in the hospital that could take care of me. So that was where I had to go for recovery, and to spend the next couple of days. It was great floor to be back on. And, again, that same male resident who said removing the packing wouldn't hurt, when he was doing that, he said, how are you feeling? And I said, I'm really cold. And he didn't say or do anything. That night, overnight, I spiked a fever and he came back the next morning. He was like, yeah, I figured you were getting an infection. And I'm like, and you didn't think to give me antibiotics yesterday? I was just like, I don't understand what's happening. Like, I told you I was cold, that I felt chills, and you were just like, you thought you knew what it was, but you didn't do anything about it. So, and then I think, in terms of your question about after being released that second time from the hospital and back to normal, I think it took a long time to just be able to get through a day without tears flowing. I took 6 weeks off of work with short-term disability. And then going back felt really hard. I was very lucky, so to speak, that I was still working from home. And so that helped because I could, keep my camera off during calls or just step out of the office and go sit on the couch and cry in between calls. But that sense of normal, the Jill before loss is not the Jill now. And it's accepting that there's a new normal. My life now is just a new normal. I'm a new version of me. I'm not better or worse. I'm just different. I've been through loss. I think in a sense, I certainly have more empathy for life and people, and much more of that in terms of, I don't know what anybody is going through. And so trying to just bring that compassion to work or to life and people that I encounter. And if somebody's being grumpy at work or somebody's being grumpy at the grocery store, just trying to be like, you know what? I don't know what you have going on outside of here. And you could have had a really hard day. Maybe you got a diagnosis, or maybe somebody was in a car accident or something. And just trying to be more empathetic with people and just being like, I'm still going to try to be my best to be kind to you, but it's okay if you don't have it in you to return that right now. Because again, I don't know what you're going through, because unless I were to, like you said, wear a badge, most people don't know that I've gone through this really, really hard loss that no parent should ever have to go through. And so I just try to bring that sense of empathy, in a lot of what I do now, because it's, again, you just don't know what other people are going through. And now that I've been through something really hard and traumatic, I can at least try my best to be kind to others.
Yeah, I think that's such an important lesson that we all sort of learn, unfortunately, that we don't know. I've talked to plenty of women who went straight back to work.
Yes.
And gosh, hats off to them, because I couldn't do that. I was in a pit. So
same. Same. I was right in that pit with you.
So
yeah, I'm always shocked when I
yeah,
hear from other women.
yeah.
I go right back.
Oh, how have you dealt with the emotions and the changes? I know you touched on that, but yeah, how have you kind of dealt with that?
Yeah, I think I mean, for us, I found a therapist that we really liked. And so meeting with her regularly, there's, in Massachusetts, there's a baby loss support group, called Empty Arms, who has helped us a lot. And they mostly help lost parents within Massachusetts, but they actually also have TFMR specific support groups for parents throughout the US. And there's even been people outside of the US in these groups, mainly because there aren't as many specific support groups for the TFMR parents. And then, honestly, it's been finding Instagram accounts that I resonate with that are loss specific or TFMR specific. And they really help because they just help me feel normal. Like I'm not crazy because again, it's when people haven't gone through this, they're like, why are it's been 2 years. Why are you still talking about it? And I'm like, I will always talk about it. Like it doesn't just go away. And so being able to see those accounts and those posts every day, it really is helpful to just be like, okay, what I'm feeling is normal because I can see all of these other people posting and commenting and liking and feeling the same way too. And so it is helpful.
Yeah, I think that's something that's often forgotten as well. Like with loss, it's not a case of, you get to that acceptance stage and then, oh, it's done. Like you don't even have to think about loss. You never think about it. It's with us.
Yes.
Our child,
it is.
Our children are always going to be with us. And those people that, people that have passed away in our lives, we still remember them and still think on them sometimes. And
yeah,
our children, in fact, more so because they're our children.
Correct.
And no parent ever but thinks that will ever happen, that their child will go before them. And I think just remembering that, I think is important. We're not going to get over it.
Yes, exactly.
We have to shout that to society. There is no getting over loss, okay? Right? It's sad, no matter what it is that you've lost, okay? Just we're going to remember.
Yes.
So is there anything that you'd want to say to anyone who's maybe in the throes of it right now, like going through, maybe a sort of period of time where they have to make that decision of whether they're going to induce or not, or maybe they've done that and they're sort of just dealing with the emotions that come along with that?
Yeah, I think it's feel your emotions and don't try to subdue them or hide them, because it's only going to make it worse in the long run. And try to search for those glimmers of hope and even just that tiny bit of light in whatever that is that works for you, whether that is, journaling or reading or doing something with your hands or finding those social media accounts that make you feel seen and heard, and finding either a therapist or support groups that can help you through it. There are TFMR specific ones that are really great and really helpful. And there's a community of lost parents who none of us want to be here, but it's a really, really good community and a really great group of people. And I think we're really good at lifting each other up, and especially on those really dark days. So just know that, it might not seem like it. And I promise you, I didn't feel like this a couple weeks after our loss, but eventually the waves start to get further apart and you don't feel like they're just crashing on you every second. And you start to feel like you can get little breaths of air. And then after a while, you feel like you're mostly just catching air and the waves just hit you periodically. And sometimes they catch you unaware and you don't know that they're coming, and then they hit you and they knock you down, but just let it happen and feel those emotions and know that you'll be able to resurface and you'll be able to come up for air and see that light and see that hope again. And that, the darkest days are right now and the light will start to come through. I promise.
Yeah, so true. And that was such a beautiful image of that wave. And it's so true. Like the wave just crashes on you sometimes, and you just have to ride that wave, let it tussle you and do whatever is going to happen.
Yeah, exactly.
You just swim back to the surface when the waves calm down a bit.
Yeah.
But yeah, I totally resonate with that. It's so true.
Yes.
Thank you so much for speaking with me and sharing your story and your experience. It's been really lovely to speak with you and to connect.
Yes, thank you so much, Ella, for having me.
Please note that all speakers, including experts and professionals, express information, views, and opinions that should not be used to diagnose, treat, cure, or prevent any medical conditions. If you have a medical issue, please consult a qualified professional. Speakers voice their own views, opinions, and conclusions, and they may not reflect the views, opinions, and conclusions of other speakers. Ella Rose, The Joy of Sunflowers, and its sponsors may not endorse all or any of the views, opinions, or conclusions expressed.